The Heart Demystified. Smarter Heart University and Dr. Scott on AM 970, The Apple.
Welcome back to Your Smarter Heart University. I'm having fun with this one. How about you?
Yeah, this is
I'm really enjoying this. Answer to the pop quiz. Got a couple of people that texted in. Currently, for healthy people without heart disease, the American Heart Association, for general cardio protection, recommends 1,000 milligrams daily for people with heart disease and only 500 milligrams daily for healthy people. This equates to eating only oily fish twice a week or supplements if you hate fish. We both disagree with this. And Bob had a great point.
Yeah, we generally don't offer our opinion on this, but I think I'm going to have to editorialize on this. You know, the most recent study that I just quoted, that was a 400 milligram, and didn't show any benefit. And there's a nice article that we've talked about in the Journal of American College of Cardiology that that says for the patients who have heart disease, 2,000 milligrams is the thing. So
if I'm not mistaken, the National Lipid, last year the National Lipid Association, which I belong to, actually said the same thing. Let's go from 1,000 to 2,000 in terms of benefits.
I think the AHA needs to revise those guidelines.
Well, let's see if we can get everybody else to believe that as we go further. First, we got to talk about some of the negatives of fish oil. The most commonly observed adverse effects from us taking fish oil supplements is nausea and gastrointestinal side effects like upset stomach or even the famous fishy burp. Taking supplements at bedtime or even freezing them, or as I cutely say to my patients, fishicles, has reduced some of these side effects. Can you take too many fish oil capsules? Well, actually, a comprehensive study has been done on this that shows there's no higher bleeding risk up to 7 grams of EPA and DHA capsules, even with patients on antiplatelet medications like aspirin or Plavix. I'm sure there's people out there that had that question. In people already who have high LDL cholesterol, that's your bad stuff, consuming more than 4 grams daily of EPA and DHA, of fish omega-3 fatty acids, it may further increase your LDL, not just in number, but also as what we refer to as density or concentration of the particles. So sometimes, folks, taking extra of something because you think it's healthy may actually be harmful. You must go to your doctor if you're going to take extra. Rheumatologists and people who take high doses often will send you for repeat checks on your LDL cholesterol. Now, a potential complication of a high fish diet, not fish oil capsules, I want to make sure I hammer that point home, it's consuming the toxic contaminants such as mercury. This is especially true for pregnant women and their fetuses. Eating freshwater fish that is high in mercury can cause extensive cardiovascular complications like plaque and atherosclerosis and heart attacks. King mackerel, shark, swordfish, tilefish have the highest mercury content, as opposed to the lowest content of mercury in salmon and shrimp and sardines, trout, and herring and oysters. Most fish oil supplements have negligible amounts of mercury. But be sure, I stress, be sure to request on over-the-counter supplements that they state pharmaceutical grade so you know you're getting pure stuff that you're buying. Okay? I'm going to say that again in our closing statements. In 2006, a review concluded that the benefits of moderate fish consumption, 1 to 2 servings a week, especially of the oily fishes we just talked about that don't have a lot of mercury, outweigh the risk in adults, excluding the fish that we just talked about, and women of childbearing age. But here's an important point. Pregnant women, following the recommendation of moderate fish, 1 to 2 a week, can expect that this intake will positively contribute to vision and cognitive development in their infants, and actually lengthen the duration of their gestation, their pregnancy, so that premature term, etc., is actually improved by just eating 2 of the oily fish. Okay. Now, common questions, and this is a good one. You people, everybody out there will like this. Wild fish or farmed fish? Ooh, this is a good one. Both are good sources of omega-3 fatty acids. Since the demand for the high-quality salmon is so high and now getting so expensive, farm fish are fed uniform rations and fish protein to allow them to contain the good oil omega-3 fatty acid content. Versus the wild fish, the omega-3 fatty acids are unpredictable and depend on the following: how mature the fish is when it's caught, and also where it's caught or when it's caught. Salmon swimming upstream have a high fish oil content, as opposed to when they're done burning off all their fatty acids for energy, have less fish oil when they've swam upstream. Now, how do you know if you're getting enough omega-3 fatty acids or you're taking the right ones? This is great. Fish themselves have variable amounts of fatty acids. Likewise, the label claims on capsules are often not federally regulated at all, and they may be at times inaccurate. Several studies have looked at this in our literature. Always, folks, turn the bottle around, look at the back label at the EPA and DHA amounts. Now, depending, and again, you're going to hear a little bit about this in our final section, what your specific requirements and recommendations from your physician are. Remember, the benefit has to be in your body, not in the manufacturer's wallet, okay? So even if the numbers are accurate, every person is different in their digestion, in their absorption, the metabolism, and the tissue levels of EPA and DHA. So variable, so much so. It is therefore not reliable to count on your blood levels for benefit, and we right now don't have any standardized way of testing you. Is it the fish or the fish oil capsule that's cardioprotective? So I answered Dr. Kaiser's question. It's a great question. The answer is they're both equal in general, okay? At least in one study of post-heart attack patients shows that they compared eating 2 meals a week versus taking 1,000 milligrams in heart patients, and they were dead even or alive even in terms of reducing heart disease. Does it make a difference how the fish is prepared? Yes, indeed. Broiled or baked fish appears to reduce the risk of heart disease, but frying it or eating it as a sandwich with bread may cancel out the benefits, or it may even increase your heart disease risks. So I thought that was a pretty good comprehensive answers to hopefully a lot of your questions out there. What do you think?
Again, the last comment
about
frying your fish, you're going to negate the effect by adding the bad stuff to it. I think it's a great debate. The issue of how many times do we get that question? Oh, I get that fish burp.
Right.
Well, make it a physical. Though you have to be careful. There are some tablets out there that the capsule. I've had plenty of people comment that the capsule bursts if they freeze it. If that's the case, then stick it in a refrigerator.
Yeah.
And that seems to help. But I think it lets the capsule get a little deeper into your digestive tract before it starts dissolving.
And I want to add that I was instructed when I'm a national speaker for the prescription brand, and when it first came out, they've changed their name since then. But when they first came out, they kind of guided me to not have the patients freeze it or refrigerate it. Their statement was that it was so pure, it should cause less of the aftertaste of the fish burp. It was the impurities that were put in by the over-the-counter supplements that really didn't look at that. Interestingly enough, when I've given lectures of this to the public, a lot of the patients have brought them in, or they'll bring them into our office, and they put cholesterol in there. Folks, aren't we trying to lower our cholesterol?
Yeah.
The cholesterol's in there. There's fat in there. There's sugar in there.
This is the over-the-counter stuff.
Yes,
yes,
I'm talking
You really
about.
don't know what you're getting.
You can look at the label.
Right.
Look at the label.
Well, that's what we recommend. The pharmaceutical grade. You got to pay attention. You can't just go and grab anything
for anything.
Right.
Hopefully in 2 weeks we talked about having an anti-aging hype versus hope. We're going to have a guy that we deal with who's a pharmacist and who has a great in the Jersey Shore area is really knowledgeable what he refers to as European standardization of developing the product and who uses better products, where they all get their line from a nutraceutical standpoint. These are the most important things when we're looking at non-medical ways to improve our health.
Right.
I love this stuff.
And then that also gets to, especially in the patients who are high risk or the patients who have established heart disease. This is not an alternative. And I always say, especially in our patients, because we do a lot of this stuff, especially you, this is not alternative medicine. This is complementary medicine. This is in addition to
adjunctive.
The established things. The idea of patients who are on heart failure, this is a benefit in addition to your established and
blood pressure.
Exactly.
We use it. I'll use it a lot of times. Patients will come in with elevated heart rates and skipped beats, and they don't want a medicine or medication, or their blood pressure is too low to support a medication. We will give them that complementary or alternative approach to stabilize the electrical system at the cellular level, and a lot of times we will add omega-3 fatty acids to help that. It works.
It works. Virtually all my patients with heart disease, I give them the 2 grams that the journal that Jack recommends.
Agreed.
And again, a difference if I'm treating triglycerides. That's a different situation altogether. If I'm treating somebody who has high triglycerides with fish oil, that's high dose. That's the 4 grams.
And we're gonna touch on that and what we can do about it section. But agreed, and that's why what you have to differentiate between what has been studied versus what has been recommended.
Yeah.
I mean, Smarter Heart University, folks, is what we call evidence-based medical approach. We want to give you what is out there as far as evidence-based medicine. So those are guidelines that you can that all physicians should adhere to and recommend to their patients. But we're also going to give you that which is studied and may have hypothetical benefit, may have some more than proven benefit in just throwaway journals. So let's give you your pop quiz number 3, Dr. Kaiser, and everybody out there. A Mediterranean diet using olive oil as its fat source and having more fish oil and poultry versus the traditional Western diet of red meat and 32% more fat reduces recurrent heart disease by 30, 40, or 50%.
50%.
Okay, so 50% from Dr. Kaiser. Stay tuned.
More Dr. Scott and Smarter Heart University is on the way on